event partners and supporters. I know a number of you are familiar with them already. Interesting fact about Chris, actually. He's the mayor of Dublin, Pennsylvania, just northwest of Doylestown. So technically, we should be addressing him as Your Honor. So please join me in welcoming Chris as our next speaker this afternoon.
Great, thank you, Simon. It's great to be here. Great to be here in South Florida. Ooh, man, it's hot in here. I think it's a little better, but so I do appreciate the introduction. And Simon asked me earlier for a fun fact or something. I think after I gave it to him, I realized I may have made a grave mistake because in today's political environment, I think I've just lost all credibility. So here we go. We'll give it a shot. So here I represent Prognos Health, talk about smarter, just-in-time marketing initiatives, leveraging real-world data. A little bit about myself. I've been with Prognos for almost 6 years now, which seems like a long period of time. But I started in the marketing services space back in 1997. So I was driving here this afternoon and realized that's almost 30 years. In fact, I helped launch aspirin back then. So, I look at customer experience, and it means different things to different folks. There's the physician side of things, there's the consumer side of things, or patient side of things. And I started out in 1997. I worked for a smaller company called IMS Health, which now, as you may know, is IQVIA. And the big focus at IQVIA was all about the physician, right? So I helped clients in supporting of physician deciling and profiling and segmentation and things like that. Qualitative, quantitative research to learn everything you need to know about the physician to lend itself to an optimal engagement with that physician. And basically, in essence, it was win the doctor, win the script. Did that for about 10 years and then went kind of to the dark side with WebMD. And I worked both on the Medscape side as well as on the WebMD side. So I got to experience working with pharma from both HCP perspective and a consumer perspective, patient perspective. But none of our solutions really tied together. It was always very siloed in terms of the engagements and interactions. And if you recall back then, when I was talking about WebMD, we were actually hated by physicians, right? We were, fake news. We were, we created the purported largest amount of hypochondriacs in the United States. But in my 5 years there, by the time I left, physicians were actually referring their patients to WebMD for additional information as kind of an extension of the services that they provided to patients. So complete dynamic change. Then spent some time, about 3-4 years, in the point of care space. If you know the digital screens that are in the exam rooms and the waiting rooms. I mean, talk about patient engagement. You're right there, front and center, moment of truth, as we used to say, before that patient's about to go in and see that physician. And we were serving up educational content along with promotional advertisements and things like that. We used to say tee up the problem and then give that patient a solution and have them go talk to their doctor and have a conversation about it. Then spent 3 or 4 years with Epsilon, which was more of a technology company who acquired data and was trying to basically figure out how to do a better job engaging patients and consumers alike, as well as HCPs. But really focusing on the consumer patient and using not only claims data and prescription data, but also socio-determinants of health data. And how does a person who owns a camper, an RV, equate to heart disease, right? And there are certain trends and tendencies that you see in the data that's very interesting if you analyze it closely. Which brings me to where I am today, 6 years with Prognos Health. And I think one of the exciting things about Prognos is that we have a variety of different solutions, but one in particular I want to highlight today that actually utilizes an understanding of the patient and the patient journey to more effectively engage with HCPs. Kind of the just-in-time marketing is the right time, right message to the right physician. So I think to kind of ground everybody, real-world data means different things to different folks. The formal definition that we have here relates to patient health status or the delivery of healthcare services via a variety of different sources. So at Prognos, we've been around for about 12 years now. Our expertise is really in lab data. So we have national and regional reference labs. We've got specialty oncology, genetic testing labs. But we also have claims data. So we realize the importance of understanding in that patient journey not only what lab tests and what lab results patients received, but also what are current and past, current, and potential future treatments that they're on as well to really round out that patient journey. So we have all that information in-house. We do have the ability to link to other data sets as well, but when I say real-world data from a Prognos perspective, we're talking about lab and medical and prescription claims data. This is kind of our brag slide. As I mentioned, we've been in business for about 12 years. The best way to think about Prognos, so we're different than most companies. We're not really a data company, which sounds kind of silly because we have all this data. We're more of a data mining company. Our expertise is technology, right? So we basically have 20 plus sources of data across labs and medical and prescription pharmacy claims. We bring all that data in-house. It is then linked via the DataVan token in a HIPAA-compliant manner. If you're not familiar with DataVan and tokenization encrypts the data to make it HIPAA-compliant, but also makes it linkable to other like tokenized data sets. And then we apply machine learning and AI to that data to basically develop what we call clinical truths across 40 plus different conditions. And we'll get into that a little bit in terms of what that means. In essence, we're putting the data that we provide to you as our client in a fit-for-purpose, analytics-ready mode, so that you don't have to spend all that time and energy and resources to do that. We feel there's a time to value for the services that we provide to you. So we've got 75 plus clients. We work with the majority of the top 10. We've done over 300 of these marketing programs that I'm going to showcase with you today, which we call alerts. And alerts have been around for a while. There are a lot of companies that do alerts, but we feel we're still highly differentiated. But in terms of numbers, because everybody likes to talk numbers, given all the sources that we have in our marketplace, we have over 325 million patients, and about a third of those actually have lab and claims data associated with them over at least a 5-year period. So we have the ability to track patients longitudinally and see not only what lab tests and lab values they've had, but also the corresponding treatments that they've been utilizing. Okay? So before we go into the situation, I want to talk a little bit about our alerts. And if you take anything away from the conversation today, there's 3 pillars that our alerts stand on. And the first one is timeliness. Getting back to just-in-time marketing. So alerts are only as good as the forewarning that they give you or the advance timing that they give you. So from a practical standpoint in our alerts, we get our data from our suppliers on a weekly basis from the previous week. So when I came to Prognos 6 years ago, we were competing head-to-head against claims data-only alerts. And through claims data, most of you are probably aware, claims data, you get the ICD codes, you have the diagnosis, you have the treatment information, you have even the test information, but you don't have the results. And there's often a lag time between, if you're using open claims, there's a couple-week delay. So our real advantage was the fact that our lab data was, again, from the prior week, from all of our lab data sources, fully curated and available to go out the door. So in essence, our alerts are only 5 to 9 days old, which if you think about your respective treatments or conditions and treatments and that time to prescribe between when a lab test is ordered and resulted and when that physician's sitting down in front of that patient, making that diagnosis and treatment discussion, you want to be there just in time to influence that decision and educate that physician on the benefits of your brand, right? Efficacy, things like that. So that's the first pillar. The second pillar is precision. And I kind of hit on that by saying, claims data gets you so far. Claims data tells you the what, right? So what's the diagnosis, what's the treatment, what's the test? You filter in and layer in the lab data in combination with that, and then you've got the why. So you've got that fuller understanding of the patient journey. Why does that matter? That allows us to create more precise profiles of patients that are fit kind of your brand label and are potentially brand eligible for your brand. So that's a precision piece because we have the resulted data. We can take it a step further in terms of creating more refined and more robust profiles. I'll show you an example of that in a minute. And then lastly, it's about activation. And activation has 2 components. One is getting you data that's usable, that has high level of utility. So a lot of clients we work with, want to know the specialty of the physician that the brand eligible patient is seeing. In some cases, when we take data in, a lot of those MPI fields or those specialty fields are not populated. But because we have the lab data as well as other data sets that we can utilize, we have the ability to bump these data sets up against each other, look back longitudinally in the patient's history, and basically find the treating provider. So there's a difference between getting lab data directly from a source and having about a 30% fill rate in terms of who the specialist is, versus getting data from us where it's 70+%, sometimes 90+%, depending upon the source, where you're getting the actual specialist. Because it's very frustrating for some of our clients who work with other vendors who are getting a lot of pathologists, right? They don't call on pathologists, they can't leverage those types of relationships. Geneticists is another example. So we're able in 75+% of the time to able to track back and alert you of who that treating specialist is that has that brand eligible patient. And the second component of activation is that we just don't do a dump and run, right? We can certainly send you these alerts, but we work with you to help basically pump or fuel these alerts into your Salesforce automation system so that we can shorten that time that it takes to do that, so that you can get those alerts into the rep's hands so they can act upon them more quickly. We partner with companies like Doximity and WebMD or Medscape to do non-personal promotion. And then we also have a digital offering as well, where we can work with your agencies of record. We have relationships with DSPs, and we can use that same alert type information to pulse that information out to your agency or through your agency via the DSP and serve up programmatic advertising to physicians in their right time in the right place. So we kind of feel like we have an end-to-end complete solution. We have the ability to track measurement and performance on the back end, do some closed-loop marketing, tweak and modify profiles on the front end to yield more targeted alerts, things of that nature, increase the funnel, decrease the funnel, however you want based upon the ROI that you're seeing or if we need to make any modifications. So this is just a quick example of one of our alert programs. So here's the situation. We've got a diabetes patient who's currently on therapy. They've got some comorbid conditions, cardiovascular and obesity related. They're visiting their endocrinologist. They're currently on metformin. Their last A1C was moderately high, so a follow-up test was ordered for the patient. So here's the sequence of events. The lab test is ordered, results come back, and as you can see, the result is outside the normal range, literally a red flag for the physician that this patient is not responding well to their current treatment. So some sort of treatment or intervention is needed here in order to get that patient more compliant from an A1C perspective. So this is really that moment that matters when the physician gets the results. They see that something needs to be done. They need to reach out to that patient, schedule an appointment to schedule the next consult and talk about their current situation and what it's going to take to get them back on track. So here's the actions that are taken, the follow-up appointment's made, HCP sits down with the patient, and there's a variety of different treatment decisions that can be made, from SGLT2 inhibitors to GLP-1RA drugs as well. So a variety of different decisions need to be made for this particular patient at that moment in time. So then basically a treatment decision is made based upon the efficacy of the particular brand, and then the patient goes on their way, and obviously we'll follow up again with the physician in due time. So that's kind of how it works in the real world. From a Prognos perspective and in terms of just-in-time marketing, this is a different kind of schematic, right? So week 1 is a Monday, you had the checkup. Wednesday, the actual lab test, the A1C test is actually ordered. The results come back on Friday. So the physician knows by the end of the week that they're going to have to see this patient again. They're not responding well to current treatment. Week 2, Monday morning, calls are made out to patients to schedule appointments. This particular appointment gets scheduled the following Thursday, so there's a big lag in between there. So how do we help you take advantage of the opportunity? We do a few things. As I mentioned, we get results week prior, 5 to 9 days, 5 on the short end, 9 is the longest. In between that time when they're making the appointment with the patient to the time that the patient actually gets into the office, we can serve up an alert in terms of, hey, we've got a patient who had an abnormal A1C score, who was on metformin, who needs some sort of therapy change. Here's the physician, right? I'll show you an actual output of this, but basically here's the physician, here's their practice address, here's their MPI, here's their specialty, and here's how many patients they had from the prior week, cumulative number of patients from the prior week that fit that same profile. So it really helps the rep, if I go back to my IQVIA days, about kind of prioritizing their call list and who to go see. So you may know the physicians on your list, but to us, the real key is like, when do you go see them? And if everything's about time management, are you going to see a doctor that has 7 patients from the previous week, or 2 patients, right? The answer might be both, but if time is of the essence, how do you prioritize? So again, we serve up the alert, and then that gives you the opportunity, as I mentioned before, this is the activation piece, is to send out some sort of email piece to the physician, do some sort of digital advertising in endemic or non-endemic content, and even have the rep go in and visit that physician. So you can do any or all of the above tactics to basically educate, create awareness, educate, and have that physician advocate for your brand. This is an example of the output that comes to you. And again, this can be delivered via to an S3 environment. But again, we also work with you to integrate this into your operational work streams within your organization. This slide actually starts from the bottom, right? So we have a very robust and rich clinical team, well-versed in a variety of different conditions across broad, rare disease, and oncology. We work with you to develop these profiles that you see at the bottom, 1 through 4. These profiles typically align back to your messages, your messaging and the content you have available to support these messages. It could be patient support materials. It could be HCP, one-pagers, battle cards, things of that nature. So we work with you to create the different profiles, and they can go from broad to very specific. So the first profile is basically, and this is a Gaucher example actually, but these are diagnosed patients, right? So pretty broad, respectively, for the condition. But then we can also look at patients that have a specific test, they test a specific result, in this case positive. You can look at patients tested for specific mutations because we have the genetic testing information available. And each of these profiles not only ties back to your messaging, but can also tie back to the channel in which you want to execute against. So obviously, you would create a broader profile. You would use broader tactics like non-personal and digital. And then maybe you create more narrow cohorts or profiles that may still action MPP and digital against, but these are kind of your gold star leads, and those are going out to your field sales force through your SFA. So this is the consultative work that we do with you, with our not only our solutions team, but also our clinical teams involved to help build these profiles for you. And then it's every week we mine our marketplace across lab and medical and pharmacy claims. We flag patients that fit these profiles, and then it's kind of an eye chart, but you get the week ending date, you get the practice name, the physical address, location, their provider's first and last name, their MPI number, and their specialty. And on the far right, for each of those profiles down below, we provide the cumulative number of patients from the previous week. So again, that's that kind of prioritization tool. We've worked across a variety of different ones. That was a primary care example, or Gaucher was another rare disease example. We've worked in oncology. This is an example of non-small cell lung cancer. I won't bore you with all the details, but as you can see, as you go from left to right, you're creating more specific, more robust, more tailored profiles that, because they're more targeted, more focused, these are kind of your gold star leads. They're appropriate not only for non-personal and digital, but also your field force. Dyslipidemia, we've also worked in that category as well. Again, very similar. You can do test results specific with maybe some sort of adverse event, as indicated in Profile 1, and we can do look-backs over 1 year or a 2-year time period, whatever your brand is designed to in terms of its label to support, all the way through to very complex profiles that, again, would yield a much more narrower number of patients, but again, those are the patients that will matter most to you in terms of your brand. This shows some of the categories we've worked against. Again, rare disease, oncology, and broad. Rare disease is really hot right now. We have not only lab data from sources like LabCorp and Quest, but we also have exclusive access to genetic testing data, which is pretty hot right now. It's kind of cutting edge. We're learning as we go with our clients how to apply that data from companies like Invitae and GeneDx. But again, we're the only ones that have access to that data to put through our marketplace and provide those solutions to you. So again, pretty broad experience across a majority of different disease states. And then lastly, why Prognos Health? We feel we are trusted. We're trusted not only by our clients, but we're entrusted by these data suppliers to handle their data and govern the data appropriately. We put strict boundaries in place in terms of how the data can be used. In addition to HCP targeting, which you see here, we support patient journey analytics too. So there's a lower level of data that we can provide that includes not only the physician information, but also patient attributes such as age and gender, as well as the test of interest and the results for that specific patient. That can be done on a retrospective or prospective basis. If you're looking to do patient journey work, we can help support that as well. We try to keep things simple at Prognos in terms of explaining who we are and what we do, but also a lot of feedback we get is we're simple to work with. One contract, you don't have to go out and contract with 4 or 5 different data suppliers, bring all that data in-house, have 5 contracts to manage, syncing them up with the same endpoints. Integrating data, tokenizing data is tough. You've got expert determination that needs to be done. All that's included as part of our fees and costs. You don't have to worry about that. It's a whole time to value story. And then last piece, which I mentioned before, is the actionability of the data, leveraging 20+ sources. We feel that it's kind of our mantra to be responsible and help you activate upon this information. We want you to be satisfied. We want you to be happy. But namely, we want to provide good results for both not only physicians, but also for our patients as well. Okay? That's all I have in terms of content. I'll open up to any questions.
Right. First of all, thank you very much, Chris. Thank you. Yeah. Nice account there. We've got